Okay, joint traction force means the muscle, when the muscles pass through the joint, in the front and back. When the muscle is spasm, it will compress the two joint surfaces together, like this. When the muscle compresses the two joint surfaces together, it will narrow the joint space. Not only that, especially over the time, over years, over months. Not only that, it will increase the intra-articular pressure. We spoke before that each joint has intra-articular pressure. Intra-articular pressure is not exactly, similar to the blood pressure. If it goes up too high, cause a problem. It goes down too low, cause a problem. If the muscle is too slack, it's hypotonic, no tone, low pressure, it can cause joint pain, and people cannot step on their feet because of the knee pain. What you do if in case of want to know this is low joint pressure or high joint pressure. The low joint pressure is very simple. You just take the two bones or one bone, you push it, you compress. You compress like that. If the pain is less, this could be a low joint pressure, and the compression and muscle strengthening will help it. Okay, what if you compress, it hurts more? Could be increased joint pressure. And now we're going to do distraction. You pull. When you pull, see the joint here? When I pull, to open. Get closer with the camera, please. Mm-hmm. Yeah. When you pull the joint space open, it decreases the intra-articular pressure. If the pain is less, that could be diagnostic as well, that is increased joint pressure, and the joint distraction will help the case. And as we said, we need to relax the muscles. If it's two muscles tight, you're going to compress the joints. In case of the lumbar disc, if the QL muscle, which is the incoming video, if the QL muscle, I'm going to jump to the back just to know about joint compression and joint distraction. If you see here, for in case of the back, some muscle called the QL. I'm going to show the picture of the QL. It comes from here, go to the ribs. That attach from the bone here to the transversal processes to the rib. The QL muscle is a miracle by itself. You can make a full lecture just explaining the QL, but just roughly, for briefly here, the QL attached from here to here, and its job is to do hip hiking. You know what I mean? If it works this way, it's called like this movement does. The belly dancers use it a lot. It's stronger in the belly dancer. But if this muscle, the QL is spasms, what happens? The ribs and the iliac crest become very close together. Like this is the normal. Normal could be like 3 finger width or 4 between the last rib, 12 rib, and iliac crest. If it's less than that, on one side or both, it could be a spasm of your QL muscle, and many patients come with a back pain. The ribs are actually here, down here, in the front of the iliac crest, or deep in the iliac crest, no space at all. This QL is spasm. When the QL is spasm, is what happened to the spine here, guys? It compresses the spine. Either shortened by arching the spine, or compressing the spine. When they make the spine shorter, it increases the intradiscal pressure and can cause the back pain, disc issues. So just to show the joint traction force, and when you relax the QL muscles, the space getting longer, 1 finger, then 2 finger, and I'm going to show this, the QL muscle. This is a picture of QL muscle. Later on. For now, for the knee here, the second thing other than relaxing the muscles, we need to be sure that there's auxiliary movements. One of the big movements we need to take care of, I'm going to speak about the bony joint now. The kneecap. Kneecap should be free to move the kneecap medial and lateral, inside and outside, and up and down as well. And the rotational movement here, guys, this should be able to rotate the tibia and femur. Why I'm saying this, my patient here today, she's very good, I love her. Okay, she came in today and her knee was very stiff. She couldn't bend it fully, she couldn't push fully, but after we mobilized the kneecap, kneecap was very stiff, no mobile at all. After mobilized kneecap, get closer. Yeah. After mobilize the kneecap, get closer. Kneecap here, mobilize the kneecap. See now, it's mobile, up and down. Okay. Her knee range of motion became much better, much easier. It was very resistant. Then I took the rotation. Kneecap here, mobilize the kneecap. See now, it's mobile, up and down. Okay. Her knee range of motion became much better, much easier. It was very resistant. Then I took the rotation out. Rotate the leg out. It was easier moving out. See, leg rotates out. Try to rotate the leg in. Now it's better now. Before was not there. If the kneecap is stiff, you know, the knee joint will not move freely and could be painful. So first thing about the bony knee is to mobilize the patella, the kneecap. Mobilize lateral and medial and vertical, up and down, and diagonal and diagonal. And be sure also the tibia rotate medial and lateral on the femur. Not only that, be sure that also the tibia can be gliding anteriorly, anterior glide on the femur, posterior glide on the femur. Be sure this is a very limited posterior glide. We're going to fix it now. I'm going to tell you later on how to fix this. If you want to fix the posterior glide, you need to put the knee joint in the free position. So put the glides. I'm going to fix the glides: posterior glide, anterior glide, lateral glide, medial glide. We need to resume this auxiliary movements. Knee is a hinge joint, like the door joint. It allows only one physiological movement, flexion, extension. But in order for this one physiological movement to happen freely without pain, is you have a lot of auxiliary movement should be happening and moving freely. Those auxiliary movements are the kneecap, as we said, all directions always, and also the tibia on the femur, always, medial lateral, glide, transverse plane, in the transverse plane, anterior and posterior glide, medial rotation and lateral rotation, both of them. And we spoke about the compression and distraction of the joint and relaxing the muscles around this before. This is Dr. Salem. If you like the video, press like. Please be sure to subscribe so you can get all the updated videos, all the new videos. We're going to give a new feed.
Bye now.